And I want to show you the auditoriums.
Hey guys, good afternoon. Happy Monday. Hope you guys enjoyed the lunch, enjoying the session so far. Really happy to be here. Alexei, do I just jump in?
Yeah, yeah, sure, please.
Perfect. Um, Happy to be here. Congrats on another silver medal that Ukraine just won on the Olympics. Um, Happy Monday. Glad to be part of this great program, several years in the running. Um, and it's going to be about 40 minutes, and we'll talk about commercialization of academic research. A couple of words about me. Um, I'm basically my whole career I've spent around these three areas of building ecosystems, uh, devising and implementing policy on the public space, and then in business, in industry and startups. So currently at Columbia, I'm a director of strategic projects and head of Lab to Market Accelerator Network, which is part of the Columbia University's Tech Transfer Office. And we'll talk more about what that usually entails. I'm also director of innovation ecosystems at the National Science Foundation Engineering Research Center for Smart Streetscapes. It's the largest center grants by NSF, $50 million for 10 years, focusing specifically. This one is on smart city technologies, next gen communications, IoTs, and AI and big data that fuses these two camps into smart cities solutions. And then prior to Columbia, I spent about a decade at working for the city of New York at New York City Economic Development Corporation during the Mike Bloomberg and Bill de Blasio years, working on devising strategies and policies to put New York on the map as the global tech hub. You may remember in 2009, 2008, there was a global financial crisis, and it hit New York really bad. And those were not fun times, and there were existential conversations about what this means for New York, how bad the impact is going to be. But at the same time, can you make lemonade when life or financial crisis gives you pretty bad lemons? So a lot of the first incubators and accelerators and sidecar investments that came out of those years, I would like it to be part of those initiatives. And also looking at what New York would be doing in terms of boosting its tech and talent pipelines. This is where you have Applied Sciences NYC, which you may or may not be aware, created the Cornell Tech University in the city of New York. And then prior to this, a number of startups in New York City, probably in the worst time to be in tech in New York, 2003, 2004, where you still didn't really have any community in tech in New York. And tech used to be pretty small behind Wall Street and advertisement and publishing and fashion and other sectors. So as you can see, it's a diversity of experiences. I'm not a scientist by training, unlike many of you, but still allows me to be sort of fluid between the ecosystem, business, and policy. Okay, so let's dive in. I'm seeing some. Um, Hold on. Okay, so everything okay on AV? Show of hands. Did you guys hear me?
Yeah, yeah, we can hear you. It's just someone in Zoom said that maybe he has some technical issues, but it's recorded, so it's fine. Everything's.
Perfect. Okay. All right, so let's look at how innovation comes out of the university, right? Like kind of where we are today, UKU, and I'm speaking on behalf of Columbia here. Um, Innovation can flow out of universities in multiple ways. And many of those ways have their own pros and cons. You can publish, you do your research and publish. The benefit is you put it out in the world. From a researcher perspective, it's pretty straightforward. You don't need to worry about what happens later. You're published, you're peer reviewed, you're quoted. It kind of builds your reputation, allows you to do more on the grant funding and others, and remain just focused on the fundamental discovery. Student and internships and jobs. This is a good way to build that tech talent pipeline, exposing students to the industry and just kind of augment their learning with the industry perspective. And then faculty doing consulting or taking sabbaticals and work at companies. A lot of the universities allow faculties to take a few months off or a year off or do projects on academic leave. And that allows faculty, again, to better understand the industry perspective. There's some financial gain to the faculty. And also, it allows the university to retain those renowned faculties because it gives them additional flexibility. You could collaborate between institutions. The benefit there is that you increase the reach of research teams, and very relevant to Ukraine at the moment during the war, where it's tough to do research locally sometimes. But then, if you are collaborating with someone in Europe or in America or elsewhere, you are starting to build the networks and the relationships that may have benefits later on. The problem with it is oftentimes it's hard to set up. Intellectual property regulations would need to be taken care of, and just like logistically, time zones and other distance and other factors come into play here. Sponsored research, this is when industry just pays money to the university to do research in a particular area. The benefit here, obviously, is financial to the university, also directs faculty in a particular area, and probably increases the probability of an impact because you already have industry signaling that this has commercial potential there. The downside is that you might be foregoing some of the unexpected outcomes of the research, right? So it's not purely free that the researchers go and do their discovery. And then licensing is almost the opposite of this. Faculty does research, and then the university then license it out to industry. This is where it's driven by researchers, but then the downside is that it's not oftentimes clear who would license this, what the market potential of those research elements are. And then you have startups where sometimes you could launch a startup either by a student team or by faculty team just to take that innovation onto the marketplace. These are not mutually exclusive. There's a lot of permeation between these, but I felt that it would be helpful to just like map out some of the ways that innovation escapes the realm of academia here. So you have these conversations. I've definitely had my share of them where people are asking or trying to put it into two camps. Is it just fundamental discovery and the rest is going to be taken care of? That's the fundamental element and nothing else really matters, and you should put all your eggs into the research basket, or research doesn't really matter and you just need to build the commercialization engine and you will be able to have impact faster, and it's all about the economy. So I would say that it's almost like a false pretense where you're providing two choices. It doesn't have to be either or. It really is, if it's just discovery, it's great, right? Like discovery does provide you something truly unique. But if you're just relying on publications, chances are that it may just stay a publication and never leave the lab and never have the impact in terms of getting that discovery into a life-improving product or societal impact. It may happen, and it has happened, and we have many examples, but the probability is much lower. And we also have many examples of innovations just sitting in a patent office or as a publication for decades, and nothing happens to them, and just kind of like lost opportunity there. But then on the other side of this camp, you have, if it's just commercialization that's not steeped in fundamental discovery, you also can build a lot of successful companies in the near or medium term. But if it's not based on truly unique innovation, you might risk never reaching that escape velocity, right? Like that could be just not really transformative, and disruptive. And this is where you oftentimes have, you've seen your share of those where it's Uber for food delivery, or I don't know, Stripe for something else, kind of like iterative approaches, which are good, and there's benefit to those too, and could have the impact. But in the grand scheme of things, you might never reach that escape velocity to like really transform the lives of millions of people around the world, right? So um, it needs to be, or I would argue personally, that if you combine the two, if you seek through discovery and you build the robust infrastructure to increase the chances and accelerate the rate from the lab onto the marketplace, you are improving the lives of more people, you're having more meaningful impact, and thereby providing resources to people that are doing that discovery in the first place. So sometimes when we deal at the tech transfer office with faculty, I would say there are two extremes of the archetypes of faculty. One goes like this, and though, mind you, these are brilliant researchers, right? There's an invention, and we approach the faculty and kind of, this is amazing. Let's put it through the filters and see if there's a commercial potential here. And the sentiment here is that I don't need any of this commercialization stuff. It's kind of, it's selling out. I just want to do my discovery. I want to invent. I want to get published, get peer reviewed, go back to my lab, build my reputation, and then be able to get more grants, just like continue this. Nothing's wrong with this approach, but it just shows you, going back to this point, that it may stay just research for research's sake, and we could spend multiple days arguing whether that's sufficient. It can be, it may not be, right? Like we're talking about the probability, and we're talking about the rate of having an impact. But then at this, but just it's I guess it's reflective of the mindset of a lot of researchers. So that's one archetype. And then the other archetype is someone invents something, and and it's truly unique. And then there's this assumption that I invented something, ergo is going to be a successful company in 5 years, and we're all going to be rich. And that's also has a lot of, not problems, but a lot of question marks behind it, because it's not necessarily connected to reality. It can be a truly unique invention, but so many things separate that invention from being a successful product, let alone a company. So a lot of the things is actually working in between these two extremes and trying to take the best of the research and then providing the infrastructure to help validate, de-risk it, and put it onto the marketplace with the goal of having a positive societal and economic impact. So there's a lot of reasons, I would argue, beyond the commercial ones for commercialization of academic research, right? So one of them is you are supporting your faculty and your students with their aspirations, and increasingly they do expect to have exposure from their universities to this kind of activity. And it's great to see UKU and other universities across Ukraine increasingly also having these elements. It's going to have sort of self-reinforcing impacts on the prestige of the universities. beyond the university, you're having economic and positive policy impacts where you are building the ecosystems on the city, state, federal levels that have positive economic and socio-economic impacts. And then also, the industry is less likely to just license early stage technology, early stage science from academia. It used to be, I would say, maybe 20, 30 years ago, that a university would invent like a compound very early on, just science, still fundamental discovery. And then the likes of Pfizer or other big industries would descend, just license it early on, and then take it in-house and then develop and then produce a very successful drug. And then the university that licensed it out would basically just sit back and collect hundreds of millions of dollars in royalties. We did this, like our peers did this, like we had over $1 billion in royalties over the last couple of decades for maybe a handful of drugs that were licensed early on. Increasingly, that's not the case. Increasingly, the industry doesn't want to license early science. They want that science to be validated. They want it to be de-risked. They want it to be confirmed that that not only science works, but then also there's a market for it, that the regulatory pathways have been cleared, that intellectual property rights have been secured. So basically, from the lab, they want this science to take a couple of steps on this commercialization path. And then they will take that science and then they will license it at the premium. But they're willing to do this, right? So they could license this technology and then keep developing just slightly later on, or they would invest in that startup, or they will just acquire that startup, or they will have a strategic partnership with the company that de-risk that science. So a lot of, I would say, macro and market trends are the backdrop to make an additional case for commercialization of academic research. And then you look at this almost like a cycle that I'm increasingly seeing around, and I'm really happy that that's the case. So just right, like if you look at the robust innovation and commercialization engine, and we'll talk more about the elements of that engine at the university, right? So like you're building this engine, commercialization engine, and that engine leads to positive and societal and economic impact, right? So that's a really good connection to have from research to real life impact. And there's significant reward and the feeling of accomplishment and just the relevancy to it. And then this impact elevates the university's recognition, prestige, attractiveness, goodwill, culture. You have like a lot of the prestige that then leads to more stakeholders and partners who are seeing these developments. And we're talking about the faculty, we're talking about students, we're talking about public and authorities, we're talking about philanthropy and industry, and then all of them seeing this, then want to be part and want to support, again, the university that builds this engine. So as you can see, right, so it's not just doing this commercialization or research because it's a good thing to do. It does have multiple impacts on this life cycle of innovation, right? Like commercialization to impact to recognition and prestige to then that leads to support of donors, investors, students, and faculty. So that's just like another mapping out. And that tracks. In the last couple of years, you would say for the last 20 years, my earlier point about de-risking this science early on through launching a small startup that would answer these questions about what's the market fit, doing some of the customer discovery, that increasingly is the vehicle that universities take technology out of the labs onto the marketplace. You're seeing cumulatively across all US universities in the last 20-ish years, it just basically tripled. And these are deep tech based on academic IP startups. And at Columbia as well, we have a similar trajectory. This is a bit of a braggy slide. I apologize for this. So these are all the Columbia startups that launched basically by year. Um, so that's not just us, like many universities have similar trajectories. This is just to make the point that increasingly startups and commercialization is the way that innovation comes out of academia onto the real life. And these are not just companies, right? Like this is just a smattering of different products that we take for granted in our lives, from Apples to iPhones made by Apple. Um, it used to be an innovation out of the lab. And it went through this process and it ended up being just a staple of everyone's life and everyday's life. So this is all doesn't just happen on its own. It's backed by significant level of research that happens on the federal level. A lot of the universities go in and bid for these grants and then conduct research, like over $1 trillion in the last 30 years. This chart is in research that then lead to inventions, then lead to then about 300,000 patent applications, and then about half of them get granted, and then 40,000, about 40,000 active licenses and options, and then about 20,000, just under 20,000 startups. So there's a lot that goes into that earlier camp that I mentioned of fundamental discovery, how this is important in order to produce these startups that are based on deep tech. You really need to have the support in funding that provides this enablement. But then it doesn't just happen on its own, right? The end of, hold on, my slide is not. Guys, sorry, it looks like my slide froze. I apologize for this. I'm here. I'm just trying to fix my
Okay,
computer.
maybe just try to share them again. Stop sharing and then share.
Okay. Okay. Looks like we're back. You see me okay, Alexei?
Yeah, it's switching.
Okay. So this is the research, right? But then the research basically validates science, um, and just basically says that this science could be a technology. And then we're not even approaching the questions of how this technology can actually survive on the marketplace. So then the scientific funnel, the university funnel, then becomes the input into the investors funnel, right? And there also, it's really difficult to make it onto the marketplace because there's a lot going on and there's a lot of skepticism and a lot of status quo and things of that sort. So think I've used this in the past, that a lot of truly brilliant people were wrong about technologies. We can see from, like saying that flying is not possible, to atomic fusion, to personal computers, to my favorite, just saying that iPhone has zero chance. And we're talking about the year. And this is the company that owned the smart handheld device market at the time. It just got completely wrong about this. And then on the investor side, a lot of people, Sam Altman, I guess he used to be the founder of Y Combinator, co-founder. Now he's the head of OpenAI, um, basically say that their investments are really difficult, and most of them are not panning out. And you have a handful that then pay for everything else. So you lose 90 to 99% of all of your investments for the chance of then having that one or two seats at the table with the next whatever, Google or what you might have it. Fred Wilson, a big VC investor from New York City, just basically said he lost money on every single one of them, and hundreds of companies, and then only one paid for everything else. So you see how difficult it is to get onto the marketplace, that it doesn't just happen because you invented something and then you assume that it's going to be a successful company and we all are going to be rich and have a house in the Hamptons and a nice couple of cars. So why is it hard? You may have seen this in the past, the Valley of Death. So if you look at the stages of going from the lab onto the marketplace, you go from basic research to feasibility to validation, and then early market testing and product development, and and sales. Who's going to fund this? So early on, that research funnel that I showed to you, that's basically funding this stage. The basic research, maybe some translational research. Beyond this, that's not federally funded activity because that becomes sort of commercialization. And the federal funding or the research funding dries out oftentimes during these stages. And then on the other end of this, you have industry that would be happy to take these innovations in if they are de-risked, if they are validated, and they are more probable to have a 20x, 30x return on those investments. And then in between is this proverbial valley of death, where a lot of these innovators just pretty much cannot continue what they do to validate science and show that the technology based on this science can work, and then that you can turn this technology into the product, and then have the company build around that product, and then have a positive societal impact. So what do you need to go through that valley of death? You need to know who your customers are or have a general understanding of the archetypes of customers. You need to have a basic understanding of entrepreneurship aspects of getting something off the ground and bringing it onto the marketplace. You need some guidance, advisory, mentors. You need access to some of the facilities. You need some early stage capital, not necessarily even as an investor capital, but even to allow you to build a prototype, to validate, if this is deep tech research. And then have the senior personnel that would then be able to run the company, and then have proper VC money, and then build out the team. And then the survival, I would probably put an asterisk here. It's not necessarily if you do all of these, you will survive. It's probably a higher chance of survival. So the last couple of slides, just checking how we're doing on time. Looks like we're fine. Last couple of slides are more to show some of the programmatic activities that we've built at Columbia that help address some of these elements, right? So you have a brilliant researcher that has an idea or has an invention, and then you have the marketplace, and then you have these steps that I just showed, that if you go through them, you increase your chance of survival and success. So some of these programs are just as an example, and I'm happy to share the background on them after the presentation, and just like follow up. They are not really unique to us. Many universities do this. And so basically they are meant to show what can be done by a university like UKU or others. So on the education, there's a lot of courses. We have a class on on frontiers of tech. I taught lab to market class for biomedical engineering. A lot of this knowledge is public. We record and make it accessible. And this is 2024. There's a lot of content that you can find if you have the desire to do so. It's not going to be hard, and also if you have the time. But it's important to do this. You either do it yourself or you discover it and make sure that you are able to share it with your communities of faculty and students. Additional resources. When we do have sessions, like let's say today's session, we would have our own guest speakers, we would record them and then put them in the so-called knowledge bank, where people can access a lecture on X, on hiring, on others. And then I mentioned that I lead L2M, Lab to Market network that focuses on activities that primarily are to validate and on the path to launch a company, right? And then on the validation, you have elements of lean launchpad methodology, some of the tutorials and workshops. And then on launch, there is some funding, how to launch, start a company, some of the business operations intensives and things of that sort. So a typical layer cake of commercialization that a lab to market program has. The elements are education, mentorship, peer network and community, and then some funding. So on education, you probably have heard I-Core model, where it's very robust, very quick. You're doing customer discovery, you're doing product market fit, and by conducting a lot of interviews with potential users, with potential clients and customers, and you're just very quickly iterating the business model and your path to market. So we do the fundamentals of this, and then we supplement it with deep dives for specific domain area, depending on what the program focuses on. And I'll show in a second some of the programs that we have. And then, of course, you have the workshops on pitching, on putting your deck together, on some of the regulatory landscapes, depending on the sector. It's really important to have the mentors and get guidance from them. And we're able to build that pool of mentors, and we make it very easy for them to provide their mentorship. We schedule meetings, we schedule office hours, we take care of all the boring stuff that to make it then easy for the mentor to spend half an hour or 20 minutes or an hour with the team that would either have a question or would need some guidance. So we basically just like are the telephone operator that would connect one pool of mentors and advisors to another pool of innovators who are still within the university world. And then as you do more of these activities, you are starting to build cohorts and you're starting to build the community, and you're starting all of a sudden to have like a pretty robust community of founders or members of teams that have gone through these programs. And then they can share some of their experiences. They can build camaraderie. They could also share their, commiserate together, because it's really tough to do something like this on top of your studies or on top of your research. So just really being able to commiserate or to share some of your fears is really, really important because you're not just hearing it from someone like me, but you're hearing from someone who were in your shoes like 2 years ago or last year. So we're trying to have these community building events. We're trying to support them as much as we can, and then allow them to be organically continuing on themselves. And then funding, of course, it's important to have funding, but I would just mention that here funding is not for the discovery. Here funding is more for that during that valley of death, to provide validation funding to clear like a specific milestone, to really validate this technology, or to conduct X number of interviews, or to do an animal model study, or like something like this, to move that, to help de-risk or validate that technology. Most of the time, that funding is not tied to equity. We're fortunate to have enough to be able to provide this to our researchers without hitting them with ownership penalties for this. And then we connect them to investors and other sources of funding later on that are not limited to us. And then, so this is the snapshot of all the programs that L2M has run so far. We don't need to go through all of them, but this is just to show that they range in focus area from cancer therapeutics to cybersecurity to carbon capture to anything in between, right? So, but this is all seeped in fundamental discovery, right? Also, it ranges in terms of its scope. Some are limited to just our faculty. Others are multi-institutional within the city of New York or the state of New York or federal national programs. So we're able to design programs that then allow other universities to collaborate together. And then also on the sources of funding, this is not just all of our money. Let's say a company like IBM or Sumitomo Corning, the one that made the iPhone glass and others, would approach us and say, we are interested in doing some innovations in area X. Do you have researchers or do your peers have researchers in this? And then so we would design a program that would focus on this area and then provide the education, mentorship, and funding for that specific area. So we would do this. So that's industry. There were a number of VCs that approached us, Material Impact, Alicorp, a number of others who have a similar interest and want to collaborate with us on launching startups to then be able to invest in them later on. And then you also have public funding from the city of New York, from the state of New York, from federal agencies. So we're able to take all of these resources and then put them together across these buckets that I just mentioned before. And then this layer cake basically becomes this one program, right? They're not all the same. Some have just application and then funding. Others have a very robust educational component. And then others all have like 4 elements, but that's sort of like a typical program composition that you could see. Some of the bragging stats on the right, you'll see, like, I think the one that I'm most proud of is almost 700 teams that have gone through some of these programs throughout the years. And it goes back to this community, right? Like we're able to then tap this community of innovators that are able to spread the word, that are able to have some of the support that we may need. There are almost 100 of exits that we've had so far. And then, of course, yes, we did some funding, distribution, and then they went on to raise multiples of that. We provide, in addition to this initial validation, let's say you go through this program, right? And then you have like $100,000, $200,000 to have the next milestone for your therapeutic or to run a pilot for your carbon capture startup. You all of a sudden have to take off the head of the investigator as a scientific investigator, but then put a head of business operator, find an office space and negotiate the lease and hire people who know how to sell and provide them with health insurance and protect them from being poached by others. So all of these sessions we put together. We work mainly with investors who do this for their portfolio companies. And usually they're happy to give an hour to give a lecture or workshop to, let's say, 30 founders from our community, right? Like, and it's a lecture, then that's followed by an office hour where individual teams would go in and then kind of have a consultation. There's also, it's less relevant for Ukraine, But there's a big SBIR, STTR program that's federally funded programs that allow academic teams, I guess they have formed startups that are still largely very early, too early for institutional funding, but then have the financial support to help with their commercialization activities. So we provide support with this. We don't need to dwell too much on it. And then next couple of slides is also some of the examples of how you could tap different stakeholders to help you. So there's a program called Executives in Residence. There are different variations of this name. Oftentimes it's called Entrepreneurs in Residence. But the idea here is you have an executive who's retiring or an investor who's between exits, um, decades of experience. They're doing pretty good financially as well, and they're willing to give back. They're curious to be involved in what's happening at the forefront of innovation within university, and they are generous with their time to help the founders go through the motion. So that's pretty much what the XIR program is. We usually have a cohort of about 10 every year, and then every year it's additional program, but then additional cohort, but we're building this community. And then, so let's say someone needs some guidance on IoTs in densely urban environment, we're able to tap like at least half a dozen of people who would have feedback on their approach or on therapeutic or on something else. So this is the cohort that we're very appreciative of. We are involved in terms of not just bombarding them with all kinds of questions. We curate questions, and we are selective in terms of how they are connected to our teams, but we definitely leverage this collective expertise from XIRs. Then another archetype is the faculty within the university. If you remember going back, you have some of the faculty that are relatively skeptical about commercialization. And then so we have all of these programs, and oftentimes just never reaches the audience, or it reaches the audience and then the researchers just don't want to apply for whatever reasons. So having the faculty ambassadors, as we call them, basically works like this. There are renowned researchers, and many of them are serial entrepreneurs. They have their own startups, so multiple startups. They get this model. They have gone through some of our programs. They understand the benefit and the value of them. So we'll leverage them by informing of these opportunities, and then we leverage them to then help promote this to potential applicants. So that's sort of another camp that we leverage. Another archetype is potential hires. Just because faculty invented something and is a scientific founder doesn't necessarily mean that this faculty is the best CEO to take that company to market. Most of the time, it's not. So you do need the marketable CEO who have done this multiple times. So it's this similar approach where you have a pool of serial entrepreneurs, serial CEOs, who may be open to taking an academic invention onto the market. And then so we're making connections between these two camps. And multiple universities have participated and are part of this effort. Then students, really important, I think, increasingly important to tap them early on. And we do this as we have our own fellows for PhD students and postdocs that do decks, that do market research, that do briefs and things of that sort. L2M has student venture associates. It's mainly graduate students that know the teams of individual programs, but then also help us set those programs up. The one, that list that I showed you on the table, carbon capture and therapeutics and everything else, those programs need to be set up. The dates, the software for applications, curriculum, syllables, all of those things. need to be done. So those SVAs, as we call them, student venture associates, are tag teaming with us and become basically the extension of our team. And then you have the diversity students also who are get exposure to it. This is all pretty symbiotic in the sense that for students, it's great exposure. It helps with their career path because it opens up opportunities that you may tap later on. It also, we pay, so there's like a bit of income that they get on top of their studies. And then for us, it's relatively affordable. It takes, a lot of managing because they're pretty early in their careers, but it's totally fine. Like a lot of them are just like brilliant and become amazing members of our team. So I would encourage you, if you're doing this, to look at your student population and leverage them as much as you can. And then beyond the students, you have investors. We do investor days with our peers. We've done, with everyone that you can think of in the Ivy League, and then we're doing with other universities. It's a day-long event, like over 200 of VCs, and about 20 from us, 20 from our peer, divided in life sciences, physical sciences, and just do rapid-fire presentations to then make the connections with potential investors. So we facilitate these. Because of this community that we've built, we speak for dozens, if not hundreds, of startups. And of course, service providers like attorneys want to be able to tap this. So we have sort of the leverage a little bit to negotiate deferred or discounted rates from the lawyers to then offer to our startups. And that's what happens when you have multiple teams and just enough of this activity, because you are providing value to these law firms, because you're connecting them to multiple startups at the same time instead of them doing their own business development. And then, just a couple of accelerators that we have throughout the campus. I'm sure it's not unique, just to highlight some of the lab space, wet lab and dry lab space that early stage startups would not be able to afford on their own. But if you're going in there and you need a couple of hours of wet lab or some of the maker space, you're able to tap as a subscription or as a license or as a membership service. And then lastly, right, it's not just me, it's not just us. It really is. It does take a village to make this happen. At the university, just at Columbia, there are all kinds of funds and student clubs and offices that focus on entrepreneurship. You could argue that it might be like too many and it's hard to know what's happening and coordinate to have the most impact. There's probably some space for improvement in there, and we're working on making it easy for faculty and students to discover and take advantage of all of these opportunities. But there is a lot that happens across different schools: engineering, business, medical center. There's also beyond the university, just specifically for us, right? So we're here in Harlem, and then you have other universities, and then there's medical campus. So and other institutions and centers that are available. So this is just me making the point that don't fall into the trap of just focusing on what you do and making sure you do it best. That's important, but you might be missing out other ways and other opportunities to leverage what's already in existence and thereby increasing your impact. And then you could keep zooming out, right? Like in New York itself, there are universities, and then you make connections and relationships with the city of New York, with specific boroughs. So you want to be a good corporate academic innovation partner to multiple stakeholders, but you want to know who else is there. And chances are there will be enough of an overlap in your goals and your values for you to collaborate in a meaningful and conductive and conducive way. keep zooming out, you have Connecticut, New Jersey, New York, you have industries, you have academia, you have similar economic, socio-economic agendas. So just being, tapped into this is something that you should look at. And then on the federal level, there are all kinds of programs that you need to be aware. And I know that in New York, there's increasingly a lot of programs that focus on dual use technologies and providing this ignition funding to these teams to help them get off the market. So in summary, right, like I've been talking a lot, you really need fundamental discovery to have a higher impact of life-improving products. Without fundamental discovery, I feel you will just not reach the escape velocity in the grand scheme of things. But at the same time, just the discovery is not going to automatically transform into a successful company. So just like having those two sides together is really important. And then how do you do this is that you do need to build this robust commercialization engine that helps with moving science to technology, to product, to company, to then societal impact. And then you would do this by multi-tiered approach that not just you do, the universities do, the community does, the neighborhood, the city, the country, beyond the country. And this is something that you need to be good at, you need to be aware of, and you need to be consistently keeping your head down and moving in this direction. So that's my presentation. If you have any questions, I'll be happy to follow up. I probably have, Alexei, like 7 minutes before my next meeting, but happy to answer questions now and then follow up afterwards. You could grab my email or connect via LinkedIn.
Thank you. Thank you, Dmitry. And I hope we can get your presentation later by mail so I can share to them with all the links and information. Well, we have time for a few questions because we have obviously 7 meetings, 7 minutes to next meeting. So
Okay, so thank you, Dmitro, for your presentation. And my question is more to how can we convert our publications to competitive advantage of our startup? Because like from one perspective, publications is work which we make public for others to use. But here is the question, how can we convert this public work to our competitive advantage? Should we like create patterns before we publish papers or so on? So just interested in your
it's not easy, it's very tricky, and you have these sort of competing agendas that whatever you discover belongs in the public realm and belongs to everyone, especially if it's federally funded. Completely agree with this, but it doesn't mean necessarily you could be smart about when you disclose it, so that not to hurt your chances of being able to, what you just mentioned, to turn it into a successful venture. This is where what we are called tech transfer office. So that's a unit within the university that has a couple of licensing officers that keep in touch with inventors, know what they are inventing, and then they are guiding them on how to do the disclosure in a way that protects their intellectual property. I know that in Ukraine, intellectual property is a little tricky, but it's moving in the direction of European market, and there are ways to file for patents and protections within the European market. Some inventions are difficult to patent, difficult to defend, especially software-based, and we don't patent. And then the focus is, mainly on executing very quickly. Maybe you might time your disclosure in a way that allows you some buffer time to do an initial prototype or to seek some of the strategic partnerships so that when you do go to market, you have a bit of a first mover advantage. So some of those things you should consider. It's difficult to give a universal answer because it differs on the sector, differs on the market. But I would just encourage you to look at specific situations and then devise a strategy based on this.
Yes, thank you.
Other questions? No?
Okay, thank you very much for the lecture. I have maybe just the general question. You know, in a lot of product launches, there are some kind of magic triangles. If you consider the product like a time, scope, money, idea, money, team, etc. What is, for example, from your experience, this basic, let's say, triangle when you have two main features? Okay, the basic triangle for successful commercialization, especially in modern Ukrainian time?
I would say if I had to choose one, it would be the team. Because often, so many times we have technologies that come out and it's really difficult to, they are fundamental discovery, right? Like it's some in photonics or others, and it's so early that it's difficult to understand if it's going to have an application in quantum computing or make a very good trap for rats. Like it's really difficult to guess where it's going to go. And sometimes it doesn't go anywhere. But if you have a team or if you have an innovator who's willing to take this to the market, I would say without the team, there's nothing that's going to happen, even if it's truly innovative, with like a couple of exceptions. So I would say that that's number one. Number two, maybe if we're talking about deep tech innovations that take years of lab work and difficult equipment to access and things of that sort. So if you've done all of this work and then you want to commercialize this, it would be unfair to you as an inventor to then give it away and not protect your intellectual property because others will just copy, who are more resourced and just like beat you to market. And it just kind of disincentivizes you in the future to do any of this because that's not, you're just not going to be able to compete with those better resourced players. But if you have IP protection, your chances of being able to defend it and having a bit of a protection on the marketplace as an early entrance are higher. So specifically for deep tech innovations, I would argue IP would come close, or at least if a strategy, it doesn't necessarily have to be patenting or exclusive rights, but some kind of an IP protection strategy for the inventor would be something that I would consider. Beyond that, you could argue on, there needs to be a robust ecosystem. There needs to be, all of those elements that I talked about before. That's probably, those two would be the top, and then the rest would be relatively equally important.
Thank you.
I think we can finish on this, so you have your time. Thank you again for your lecture, and maybe next year you'll have something like mentorship from your side because we had this request about the mentorship. Maybe you're not directly connected with data science, but it would be interesting to try at least maybe analyze some data about these ventures.
Yeah, absolutely. Happy to. Please reach out afterwards, and hopefully next year I'll be able to do it in person finally. I know that it didn't pan out last year, and this year I was supposed to be there with Vaughn, but hey, we'll get it done. Guys, best of luck. Have a great day ahead and for the rest of the summer school, and I hope to hear from you afterwards.
Thank you. Thank you, Dmitro.
Bye.
And now we have an Isaac coming. Yeah, we got a lot of questions on previous lectures, so we have like very small time. Do you need? I think we can manage the last lecture without an interruption. Yeah, we can start right now because we have a tight schedule. Okay, so I will give you co-host so you can. Okay, the floor is yours. Maybe you can.
All right.
Please.
Hi, everybody. It's nice to meet you. I'm sorry I'm not in person, and we can't meet in person. As the last speaker said, maybe next year there'll be more opportunity. And thanks a lot for inviting me. I prepared a set of lectures with my colleague Vijay, who's on the line. He's going to speak a little bit at the end. The second lecture is going to be sort of more practically focused, some methods around what we're talking about today. I'll give about 2 minutes of background on myself to give a little bit of context, and then I'll just jump into the lecture, and hopefully it'll be helpful. The focus of the lecture is really on the use of large language models primarily and generative AI overall for therapeutic agents. So those could be health agents to help people with simple tasks. The focus, my real focus is in the context of mental health and psychotherapy, but those same methods can be thought of much more broadly. So my hope is to give just some overview on the real world context and the use cases we're thinking about really practically, and then some of the under the hood methods. And I'm keeping it very general because unfortunately I don't know the class well enough to know who knows what starting the lecture. So I'm going to speak more generally about the modeling approaches and what they offer and some of the applications, and really hopefully leave enough room to get some specifics from the class, about what's of interest or any particular questions. So as a little bit of background, my PhD is in clinical psychology from Columbia University, where the last speaker was from. My postdoctoral training was at NYU in bioinformatics and machine learning and neuroscience, mostly around stress and trauma. So most of my early research when I worked full-time in academia was at NYU in the School of Medicine, focused on methods for early intervention after traumatic events, how to intervene in large-scale traumas, things like earthquakes or war zones where there's a lot of unexpected mental health need and not a lot of methods to coordinate care. And so a lot of the focus of my research has been on how can technology enable both the measurement of mental health functioning in the real world and potentially interventions on top of it. The intervention component is one that's really accelerated a lot with the development of large language models for some obvious reasons, but I'll talk through it in the lecture as well. And so I'm going to talk about just generally that field, what are the underlying concepts, and then really what has natural language brought to the table and what should we be thinking about if we're trying to develop agents to do therapeutic tasks where we may have to think about certain content areas and also different approaches to validation than if, for example, we were building agents to sell you shoes, where it's a little less, or some other type of task where validation is a little less strenuous or less important. So let me pull up my slides. Make sure I don't end up in a. Oh, okay. Okay. So, oh, okay. Did my slides come up? No, not yet, right? Can you see my slides? Sorry. Yeah, you can. Thumbs up. Sorry, I can't hear any. Oh. Yeah, okay, cool. All right. So let me, okay. So I want to talk today about the use of conversational agents for clinical interviews and psychotherapy. Once again, the concepts you're going to be seeing here are really applicable in any context where the medical use cases or the clinical use cases involve getting information from a person through natural conversation and enacting some sort of intervention. So the sort of purest example of that is psychotherapy or mental health interviewing, where really all of our symptoms, for the most part, are garnered through conversation with someone or having them provide me information, as opposed to other areas of medicine where I may have a combination of getting information from a person and also some biological lab tests or other approaches to really understand, what is their specific illness. So as I'm going through these examples, please think about them in the context of really just clinical interviewing generally and what does it have to offer. Okay, so what is a clinical interview? What does it mean to interview a patient and speak to them? I like to, because we get into technical things really quickly, I like to start all of my lectures with an example of a real patient. And what do they sound like? What do they look like? What would somebody expect? And as a clinician, we had to interview, get to know real patients, do psychotherapy as really a way of understanding. So let me just start this. This is an example of an interview with a patient with major depressive disorder. And I'm not sure if you can hear the sound. Probably not. Let me see if I can. Oh, yeah.
Hello, Alison Wells. Do you want to come and have a seat? Hi, I'm Dr. Taylor, one of the GPs at this surgery. What would you like me to call you?
Alison will be fine.
Okay, okay. So what's brought you here today, Alison?
My sister's noticed. I'm just a bit fed up, really.
Right, okay.
My sister said I should come.
Right, okay. Has this been going on for some time?
Yeah, a few months, really.
Okay. Yeah. Do you want to tell me a bit more about what's been going on?
I just things seem to be piling up.
Right.
I just don't seem to be coping.
So even in the first, I don't know, what was that, 15 seconds of that video, we see a certain presentation from this individual that really points us to think about what type of psychopathology they might have. So she's showing really stereotypical signs of major depressive disorder. And if I had you watch the whole 45-minute video, which would be more or less the whole class, you would hear her talk about various symptoms, experiences she's had, poor sleep, her mood being low. But even in that brief moment, you can observe things that if you've had family members with depression, or if you worked in a clinical setting, or even just, exist in our culture, you would see as really stereotypical signs and symptoms of depression. Those include talking slowly, the content is very sad, she feels very hopeless, she's describing just feeling overwhelmed by her situation, she's not moving very much, her head is turned down, she's fidgeting. These are all the types of signs and symptoms that clinicians learn to look for when interviewing a patient. And as you can see, the clinician is giving what we would describe as a semi-structured interview. So she's going to ask specific questions that she knows are relevant, but she's engaging with this patient really in a very conversational style that allows her to pull out relevant information, allows her to observe this person naturally, to really get a sense of who they are. So a clinical interview can take a couple of different structures, and this is important to know as you're trying to build methods to be able to, for example, run over a conversation like this and do some sort of analysis. So if I was to take this video as a data source, I might say, how would I measure those characteristics that I'm seeing from this patient and quantify them? So some of that might be methods in computer vision, like measuring facial expressions of emotion. Some of it may be vocal parameters, like how fast is this person talking or how quiet are they? There's a whole separate area of machine learning, which we'll talk less about today. And the other you may pay attention to, which is often the richest source of data, is the actual content of what this person is saying. So she's expressing just feeling overwhelmed, feeling hopeless, not being sure what to do. These are all sort of common sort of topics you would expect. So a clinical interview could be structured, could be semi-structured as we're hearing here, or it could be completely unstructured, where really the goal is to have a conversation and really get to know the person. In a structured assessment, you may target really specific symptoms. So for example, if you were conducting research, if you were using, if you had interview data from a research study, they may specifically focus on asking about specific symptoms. Once again, those types of conversations can be quite unstructured because, for example, if I ask a patient, how did you sleep? They may say, I sleep poorly. What does that mean? Requires further digging, further conversation to get at a more specific operational piece of information. The key elements of an assessment that one is trying to capture are history taking. So what is the presenting problem? This woman, how long has she felt this way? Developmental history. It's very common in mental health, but relevant in many disease disorders. Is this an ongoing issue? Did her family have depression? This may give information about if it's a more biological type of depression or social depression. Psychosocial history. So her own social interactions. Does she have family? Does she have friends? Who does she rely on? How does she cope with different situations? And then specific symptoms and diagnosis. So what is the goal of this assessment? The goal of this assessment really is just to pick the right treatment or decide if treatment is really relevant. So we can think about measurement and measurement of the patient through interaction as really a stepping stone to making a decision about how to engage with that patient, and really measurement and engagement being an interaction that's ongoing until the end of treatment. So assessment is not a one-time occurrence. So let's talk briefly about the other side of this, which is talk therapy. And we can think of talk therapy as really generally a treatment for a mental health condition. So for instance, we're going to have 12 weeks of talk therapy to improve major depressive disorder, and also just think of it as a facet of any treatment. So as a good example, talk therapy or just interacting with the patient, encouraging them, motivating them using a certain strategy is one of the most effective ways to have people, say, maintain a medication adherence or stick to a regimen. So what are the principles of talk therapy? So once again, I'd like to just give two examples. I'm going to show two brief clips, and really the purpose is to show you how diverse psychotherapy can be. So this is here's the beginning of a psychotherapy focus on depression, which is actually quite structured.
Hi Lucy, nice to meet you.
Hi.
So I understand that you were referred here by your GP because you've been feeling quite down recently.
Yeah, I thought I've been feeling quite bad for quite a while, so I thought maybe it's time to see someone about it because I don't want to feel like this anymore.
Okay, so from your notes I saw that you saw the GP about 3 months ago.
Yeah.
So how long have you been feeling down altogether?
Quite a few months before that as well, actually, but it's gotten pretty bad these past few months, so that's kind of why I came.
Okay, so has it got worse since you saw your GP?
Yeah.
Okay, so tell me, how are things at the moment?
Well, it kind of started just feeling a bit low and wound up about things, but I don't know, just recently I I just can't really be bothered to do anything at all. I kind of find it hard to get motivated for things. And I went recently.
So in this first interview, the psychotherapy actually looks quite like an assessment where they're going to structure the therapy around the specific presenting problems, the course. She's assessing the severity, time course, and any interruptions, and then just tailor the therapy and continue assessment along those lines. Here's a much more open-ended type of therapy.
Like right before it started to New York.
Yeah.
It was like my first time there, or not my first time, but first time in a long time.
When was that?
This was about like 2.5 months ago.
Okay.
And I was really excited for this big trip, and I got to visit my friend who's starting grad school at NYU. And for some reason, we were walking down the street, and out of nowhere, I got like this feeling of anxiety in my stomach. And I was like, oh, this is really weird. Like, I haven't felt anxiety in years. Like, wonder what it's coming from. I hope it doesn't come. Like, all the typical thoughts that come with anxiety.
Yeah.
So that was pretty...
So out of nowhere, you just suddenly were
and then I tried to dive into it later. For some reason, it made me feel very anxious and insignificant, and just like, wow, there's so many, like, why does it matter if I sit on this bench or if I don't sit on this bench, or why does it matter if I wear these shoes or other shoes, or if I say this thing or not this thing? So that's kind of where it started growing. And then it started growing more into like more existential thoughts of like, who am I even, or like, why are we even here, or like, what's the point of anything?
At this point, as a therapist, I feel a bit bewildered. One thing I know for certain is that this sudden attack of existential angst does not come out of nowhere.
So in these two examples, we see very different models of what psychotherapy is. In the first one, the target is really focused squarely on symptoms, identifying symptoms, thinking about what would reduction of symptoms look like over time, what are major precipitants. The second one is much more of what we consider an existential therapy, focused on what is the meaning for the person, how can we derive it and understand that individual. And so as we can imagine, these two different scenarios, even the concept of psychotherapy is really distinct in terms of what do we want to get out of it, what are the goals. So if we're thinking about how do we automate something like psychotherapy, what is effective, as you're watching this, maybe people in this audience might think about one of those therapies is more relevant to them or more interesting or more meaningful to them. How can we really think about the personal needs and the diversity of what psychotherapy is, or even what it is we need to assess? So what are the different principles of talk therapy? There are different schools of thought. So the second example that you looked at would be much more of what we would consider psychodynamic or interpersonal. Those types of psychotherapies tend to be relatively unstructured, really dynamic and responsive to the person, focused on personal and interpersonal understanding more than symptom reduction, and are focused on what we would call insight, learning things about yourself. In contrast, there are behavioral treatments like the one at the top that are structured, focused on behavior change, focused on symptom reduction. So as an example, you're having trouble sleeping, what are the behaviors or actions that you can take? What are the negative cognitions that you can challenge to try to change that behavior? So the final category being cognitive behavioral treatments that are really structured but focused on not just behaviors, but also the thoughts and emotions as types of behavior that can be addressed. So for example, in a cognitive behavioral therapy, you might think of negative thoughts about yourself as problematic cognitions that you would take a strategy to change. So for example, every time you have a negative thought about yourself, I want you to say stop as an intervention. Very behavioral, not interested in what's under the hood or what the meaning is. And the core components of therapy include characteristics like the therapeutic alliance. So do I trust this therapist to give me guidance? Do I believe in their advice? Active listening. So the therapist being able to detect things in what the user is saying or the patient is saying that are actually quite complex and nuanced, emotional engagement. So how do I read the patient's emotion and respond appropriately or share emotion appropriately? And those all layered on top of what we call evidence-based techniques. So techniques for which there's evidence that implementation of this method does improve outcomes, however I define those. So these core components, we might start thinking about how can we instantiate those, once again, in a programmatic way. So now I want to give about 5 minutes on some relevance of why it would matter to create methods for immediate measurement and intervention. These are some real world examples from my own research, particularly around the area of stress and trauma. Stress and trauma is a really unique type of mental health concern. The reason is that almost all of us are exposed to traumatic events across our life course. So about 95% of people, even in first world countries, will experience what we would consider an event that can cause post-traumatic stress disorder. And what's really interesting about trauma and traumatic events, no matter which they are, if you're interested in reading more, there's a clip at the bottom that's one of my review papers. People are very heterogeneous in how they respond to traumatic events. And there's not a lot understood about why people respond in different ways. So the majority of people tend to be resilient. They tend to be disrupted by large events, able to cope, able to continue on with their lives. There are people who develop psychopathology and are able to recover. There are people who had psychopathology before, and then events can really exacerbate their experience. The real challenge in the context of trauma is knowing who is going to follow which course and what do they need along this course of response to optimally be resilient. And so that's a real challenge in the context of large traumatic events, is how do you help people to be resilient or help people manage, given that we are very heterogeneous in our needs. The course is heterogeneous, even the threats are heterogeneous. One approach, which I have another review paper, Nature Psychology on, is appealing, but very hard to understand how we would instantiate it in an analog way or without the help of technology. So the things that we know from our research is that there are certain baseline characteristics or characteristics people have before an event that can help them, like find consistently that people are optimistic or have certain coping strategies beforehand, tend to be more successful, but it's very hard to know who is who before an event happens, because it's very hard to know when a traumatic event will occur. The things that we find to be really effective in coping with any range of traumatic events is really a series of capabilities people have that we can help enhance through interaction, but we really need to be available and with them to make that happen. So you can see how that could be limited in terms of psychotherapy. So those steps include what we call context sensitivity, or the ability to really read your situation and evaluate the demands and set goals based on that context. Repertoire, having a set of coping skills ahead of time or having access to a set of coping skills to help manage the specific context that the person is in. And then feedback, the ability to read the response and the efficacy of your strategy and then adapt it appropriately. So all of those steps can lead to more resilience really across different types of traumatic events, but really the ability to, as a therapist, to do that kind of intervention is quite limited. So in that context, one way that the field sees to be able to deliver that kind of care is through digital measurement and digital intervention. So ways that we can assess what is this person's current psychological state, are there methods to approach that, and then there are ways to match an intervention to achieve that. So this is another review paper I wrote if people are really interested in this topic. This review mostly focuses on computer vision and voice markers, but same concept, which is really how can machine learning and digital measurement really be helpful for psychological health. So if you have time, please feel free. But a concrete example of this is some ongoing work that I started with NATO about 5 years ago, which was which brought me to your guys' neck of the woods. We met in Odessa about 5 years ago as part of a group called NATO for Peace, where we were asked as a group of scientists to answer the question, what would we do for psychological interventions in the immediate aftermath of a war zone, really with the concept that the region was at risk. And what we did is we put together a set of guidances on approaches to early intervention, really focused on what are called the 5 essential elements of immediate and midterm mass trauma intervention. So we know that there are certain elements that are very important to offer to people as traumatic events unfold to help them manage the psychological effects of that event. The real limitation that we found was that there's no digital solutions to deliver those. So even though there's things that we know work well if we're in highly resourced situations, so for example, a lot of the strategies that we deployed in New York City after the 9/11 attacks to help people understand the situation, help people cope with immediate stressor, find loved ones, et cetera, really not available in a war zone. So one of the questions that we asked, and we're continuing to ask as a working group, is what are the interventions that can we deliver without, through technology? And as an example of the directions that we were going before the development of large language models with really a large capability were things like how could we measure, say, autonomic arousal through wrist wearables to know when somebody's under high stress. So this is an example of some of the work I've been doing at Google on measuring stress via electrodermal activity on the wrist. This is a Fitbit Pixel 2 watch, and in it we have electrodermal and heart rate sensors, and from that we're able to derive moments of high arousal. And so an initial idea that we had was, let's identify when people are high arousal and offer interventions. That generally is not a very effective strategy because we have high arousal all the time for all kinds of reasons other than stress. So it's not really that specific. Where we can find a lot of specificity is in the field of psychology, is in natural language. So I'm going to pivot now to talking through what are the ideas of natural language in psychology, what's the development of machine learning models to do those tasks, and then really where's large language models taken us. So, and let me just check in. We're about half an hour in. Just give me a thumbs up to know you guys are still with me. Yeah. Okay. Very cool. Okay. And please, I don't know what the best way to approach this class is. So if people have questions intermittently, let me know what your preferred format is. So feel free to interrupt me at any time. So let's talk about natural language models generally in psychology, really, before we're talking anything about large language models. So what does it mean to measure mental states using natural language? Well, natural language is actually, pretty intuitively a great source of information compared to other types of measures that we might use to try to understand people's psychological states. So as a good example, what I just showed you, lots of the research that has been developed over the last 20 years that really developed primarily in lab-based settings is to say, what are the physiological proxies that indicate somebody's in a certain psychological state? So what does somebody physiologically look like when they're angry or upset or under a high level of stress? Can I detect that signal? And then can I, in effect, develop some sort of classification model to say, oh, this person is under stress? And for all the reasons I just mentioned, and some pretty obvious ones, that's always going to be a fallible indicator of their mental state, and you're never going to get a very strong algorithm whereby, based on the physiology, I know somebody's internal psychological state. However, language is sort of the opposite. Language, in psychology, almost speaking or articulating is the process of creating meaning. And so if I want to know if somebody's stressed, just asking them directly, are you stressed, is a pretty intuitive, straightforward way where I would get very high agreement between their self-report and my measure. So intuitively, natural language seems like a good source of psychological information. Language is by definition, a way of conveying information. Language may in fact be the act of constructing psychological states. So it may be that in fact, we don't even have articulated what the psychological state we're in until we put language to it. Measurement is challenged as language is thought of as having no ground truth to measure against. So the real limitation we have ultimately in validating some language model of a psychological state is the same one. We don't have a ground truth to build a classification model against. So how do we get information from language? What are some simple examples of how we could use natural language to understand psychological states? So, on its face, we're probably all familiar that we can tokenize language to extract certain information. So for example, can I measure the word frequency? So in the example of the video I showed you at the beginning with a woman with major depressive disorder, she would, if I collected up just a count of words across that conversation, what I would find is that she was speaking much less than the interviewer. And in fact, a person with depression compared to when they're not depressed will be speaking much less. So even just what we call a bag of words or the count of words itself tends to be an interesting and somewhat effective measure related to disorders like depression, but also other disorders like negative symptoms in schizophrenia or dementia. Certain word classes. So do people use a lot of emotional words? We heard in that interview, the patient was using a lot of emotional words. She's feeling frustrated. She doesn't know how she's going to handle her situation. Are those certain word classes more common compared to, say, other types of words? She's not talking about her groceries. She's not talking about other sort of information. Word similarities. So are there types of words? So she might not say the word I'm depressed, but she may be using words that are synonymous with depression. And we see sort of similar class of word. So we can capture constructs like emotionality, verbal complexity. So, does this person speak, for example, at a high intellectual level, rate of speech? These may all map actually directly to certain types of symptomatology that we can use to say, okay, this person is displaying this symptom. As an example, as a very stark example, there are many neurological conditions where people can't produce speech or they can produce very little speech. And so those types of measures themselves might just be a direct measure of a symptom. So examples are, like I said, bag of words, emotional word frequency, speech onset, offset. So a good example of a common indicator of depression is speech onset. When asked a question, people with depression will initiate speech more slowly. Once again, for the same reason that they're generally motor slowed. So I'm going to pivot to talk a little bit about machine learning methods for understanding language and how they evolve into the large language models that we see today. So I'm going to talk briefly about BERT models, which are bidirectional encoder representations from transformers. BERT models are really used for understanding language context and relationships between words. So the previous example I gave you, let's say I want to measure the emotionality of someone's language. I can just look at the frequency of certain types of words, but I don't really know much about the relationship between those words. And the way that we use language is very much words themselves don't mean as much as the context around them. So what are approaches to really learning those contextual relationships to better understand the language itself? So here's a very sort of simple explanation. Imagine Bert as a super smart student who has read millions of books and learns how words relate to each other. So the way that BERT models are trained is in effect, and this really gives us insight into how large language models work, is rather than learning, okay, let me learn all the synonyms for the word sadness, let me create a list such that if I see any of these words, I'm going to make the word sadness. Let's actually start by just learning the relationships between all words from very large corpus of language, and then be able to really understand, is one word related to another one by its relationship in some context. So BERT models are pre-trained on massive text data sets, which learn to map words and phrases to high-dimensional vector representation. So BERT doesn't just see words as just letters; it converts them into complex numerical code that capture their meaning. So, as a simple example, think of it like giving each word a unique fingerprint based on its meaning and how it's used with other words. So now I have a word, I can understand the many contexts for which that word is used, and so then given some sort of sentence, I can make a prediction: is that the right word, or should I use some other type of word? These representations capture the contextual meaning and relationship between words, allowing for semantic similarities to be calculated. So BERT understands the word bank has different meanings. So in riverbank or in money bank, the same word can mean totally different things. And in a traditional natural language model, this is exactly where the model might get confused, where it's trying to predict a certain word, but is unable to know the context, and then is unable to use it in the right contextual fashion. So BERT, for example, can tell that happy and joyful are closely related in meaning, while happy and sad are opposites, just like we do. BERT models can be used for classification. Oh, sorry, oops. Sorry about that. My slide is covering some of my text. I put this like cute little figure into, but let's see. So BERT models can be used for classification of psychological states. We can use BERT models for sentiment analysis, emotional valence, emotional intensity, in a much more robust way than we used to be able to get sentiment analysis just by using lists of synonyms or our common word frequency. BERT models are very effective at topic modeling. So as an example, within Google, we use BERT models quite a lot for health topic classification. When the user is talking, can I know what are the important topics to them? Those are the types of things that I could use a large language model for, but to generate a solution, but would be sort of like killing a mosquito with a machine gun. So I can get actually very accurate topics just out of using BERT models. And so, a kind of common example would be detecting depression from social media posts. If I really rely just on, certain keywords, those might be used in all kinds of contexts. The word suicide can be a word in a band name or a reference to, some, piece of hardware killing itself. But in a certain context, can be much more meaningful. So a lot of these methods have started to be applied in that context. Sorry. BERT models are also really useful in a lot of early applications of therapeutic chatbots, like the examples I'm steering towards. A lot of those early models use BERT models, because they're able to make predictions about the right words. So traditional early application of chatbots are really rule-based chatbots. So given some predefined response, creating some predefined response based on keywords or a decision tree. So if the person says this, you go here. I have a fully defined decision tree. Those tend to be really lack any kind of flexibility and any real natural language understanding. So if they say a certain word, go here. If they say, this, go there. The use of BERT models or other natural language powered models really improves that quite a lot. And a lot of early products you've seen chatbot based models use these more simple forms of NLP. So using machine learning methods like BERT for more nuanced dynamic interactions can work something like this. You can use BERT models to first capture some sort of understanding of the user. BERT reads a message and understands the meaning, even if the user uses slang or typos. Those things aren't going to trip up the model. It's able to listen carefully to what the person is asking for and follow, really being able to use language in a much more flexible way than earlier models. BERT's able to find the right words, so it's really able to make predictions based on what the user says, to build a really much more dynamic response. So early examples of chatbots like Wobot or Replica or other types of assistants really just utilize that technology, and those are as good as all of our experiences with those kind of technologies. They're really a step forward from where we used to be, but they really have a number of continued fundamental limitations. So the challenges for psychotherapy chatbots are that humans are a lot more dynamic than these kinds of agents are prepared for. There isn't always a right answer, so you may need models that can not just solve conversation like a classification task where there's the right answer is potentially known. And humans pull from very large pools of knowledge, not just knowledge in this particular area, particularly in psychotherapy or in medicine. So as an example, I worked on an early BERT-based chatbot to offer what's called motivational interviewing, which is a type of psychotherapy. And, even though we had a large corpus of psychotherapy data, we really didn't have a large corpus of data generally to pull from. And anybody who's been in psychotherapy will know that a general understanding of the world and other topics and metaphor really is what enriches psychotherapy and makes conversation generally pretty rich. So this really moves us into the era of large language models. Large language models are deep neural networks trained on massive text data. So now we're talking about training on billions of parameters on trillions of tokens. Those are, as we all know, those are built within very large companies that scrape very large segments of the internet to be able to find those relationships, first in words and then in images. And as a result, they're able to generate human quality text, translate language, write code, etc. So large language models you can think of really as, and this is probably too simple for this group here, but you can really think of large language models as sort of the intersection of deep learning models with natural language models, all nested in this world we call AI, which has different meanings to every person, but really is ultimately just the application of machine learning models, very, very large pre-trained models. So what is the relationship between BERT and LLMs? BERT focuses on understanding language, like figuring out the meaning or words in context. LLMs take that a step further. So you can think of BERT as sort of like, a first step or the encoder part of the large language model. They use the understanding to generate a new coherent and contextually relevant text. So BERT is really a building block of these large language models that really their advance is the ability to generate new solutions rather than be classification models that give you, a choice between solutions. So how do they work? LLMs learn patterns and relationships within the data and uses this knowledge to generate new text that is similar in style and context to what it's trained on. It uses what's called transformer architecture. So think of a transformer like a master translator of language. Instead of processing words one by one, it analyzes the entire sentence simultaneously, capturing the context and relationship between words, much like BERT does. On top of that, it offers a generative model, so it doesn't just encode, it also generates a solution. So a generative model is like a creative writer who has learned from reading countless stories. It doesn't just understand existing texts and be able to repeat those texts as you, it can generate new texts in that style or using those concepts. Using the original text follows patterns that it learns. So it learns 20th century poetry, what are the rules, what are the ways that verbs relate to nouns, relate to adjectives in certain languages, and then is able to produce something in that same style or following those same underlying rules. LLMs have both an encoder and decoder, so transformers utilize the encoder or decoder structure. The encoder is one where you can imagine the encoder as a detective carefully examining a sentence, breaking it down into the essential components and understanding the relationships between them. It creates a representation of the input sentence. And then the decoder is like a skilled storyteller who's then able to take that and create something new out of it. As probably everybody in this audience knows, large language models are really just the first step in generally an evolution of generative artificial intelligence, including images, multimodal data. We now build generative AI out of genomics information, proteomics, et cetera. Really, it's more about learning really a global representation to be able to solve local problems rather than building models to solve local problems and then have results.
For 10 seconds.
So I want to do a time check really quick. We're about 40 minutes. So let me see. Let me give an example of, let me check in with everybody. Does anybody have any? I just want to make sure I don't need to pause for any questions or anything like that. I can continue moving forward. Just want to check in with the class. We're good?
Yeah. I think everyone is following, and it's great.
Okay, cool. Yeah. As you know, it's a unique structure to teaching a class. Yeah. So, okay. So I wanted to give an example that actually stepped backward from language to really help people understand what this process of encoder decoder buys us, and really what really understanding a global representation to get at a local representation to solve a local clinical problem, sort of how that works. And so I'm going to step away from language for a second to just talk a little bit about encoders and decoders and give an example from computer vision. So this is an example of some work that I did a couple companies ago before I was at Google, before I was at Meta. I was at a company called AI Cure, where what we did is we attempted to measure symptoms using computer vision. So a good example is measuring tremor. So many different disorders have tremor as a symptom. Hand tremor can look like this. And I'll give you a really quick clinical example. So this is a woman with a hand tremor. She's videotaping herself, and we created a little metric on the right to measure how much tremor she has on a clinical measure, and I'll get to how we did that, and how that connects back to the concepts of large language models, hopefully.
I will let you know when you can stop.
So as you can all see, this woman has an abnormal amount of hand movement, right, that we could call a tremor. Though probably few of you are trained as clinicians, all of you could look at that and say that's abnormal. But if I wanted to take that as a data source, analyze it, and say that it's abnormal, I'm really in sort of a challenging spot, because what is an abnormal amount of movement? How do I quantify that? Even though that's something that a clinician may be able to eyeball, or even a trained clinician may be able to tell some nuances, at the end of the day, my ability to create a metric out of movement to say what is abnormal movement is a real challenge. So so we built a measure like that for clinical research, and it really follows much of the same logic we might think about in terms of how do we build a large representation and then solve a local problem, much like we do for large language models. So in this instance, so what we do with large language models is we try to understand the universe of language, in effect. What's the relationship between words? How are they used, really in a really global sense? Can I build a model that understands, has encoded those as parameters such that I can ask a really specific question like, what is, abnormal conversational? What does it sound like to be depressed, for example? So what we did for hand tremor is very similar. What we did is we took healthy people and we passed different amounts of voltage through their hands. So this little guy with the blue over his face, you can see some wires coming off his hand. What we're doing is we're shocking the hand to actually artificially create different levels of tremor, from none at all to as much as the muscle will spasm. And we built a computer vision model where we then extracted different color spectrums out of that hand to be able to use a method that allows us to measure movement as the change in color from one frame to another. So the displacement in red, blue, green from one frame to another can tell us the amount of movement. That's a method called optical flow. So what we do is we extract the optical flows or the amount of movement from one frame to another. And what we do is we use an encoder to say, to approximate what is the distribution of movement of the hand. So think about this as the universe of hand movement, much like we would say the universe of language, though hand movement is much simpler because it's on one dimension. So it's much simpler than language. It's a very, very high dimensional problem. But in effect, we can say, what is the distribution of these? And then a single example of hand movement, which does it fall into? Which part of that distribution does it fall into? So what we've done is we've tried to understand the characteristic of movement more generally, and then interrogate that model to ask, in this instance, which class would they fall into? Now, I could take that a step further and use a decoder to say, now create ranges of hand movement for me, which is what we did here actually, to then create more sample data to be able to better characterize those distributions. And as a result, we were able to then take clinical patients with video recordings of hand tremor who we had not trained models on and very accurately predict where they are, create a prediction of which range of movement. Are they in a normal range of movement, a moderate range of tremor, or severe tremor? So hopefully that's by stepping into an example that's outside of language, that's been helpful to understand the general concept of generating, first encoding a world representation of some concept or some space, and then using that to understand a specific example or situation, rather than training specifically on people with tremor or not with tremor. So what is the process of model development? I'm going to now jump back to large language models and talk about how we work with them. So assuming that nobody in this room is, including myself, is responsible for building base large language models, really the question is, how do we put them to use for our use cases? I'm going to talk a little bit about training and improving large language models, talking through examples of pre-training on vast amounts of text. So if I want to build a general model, we've talked a little bit about that. Fine-tune on specific data sets for targeted tasks. So let's say I want to build something that's an expert in something really in particular, or final class, which is reinforcement learning. Really, how can I learn and improve my specific model and tune to an individual? So let's talk for a moment about fine-tuning and prompt engineering. So you're probably familiar with different types of large language models. These are all examples from Google where I work, but OpenAI has examples, Anthropic has examples of different types of language models you might use for different purposes. So these are all the number of parameters is represented by the size of the actual model. This isn't to scale per se, but it's just to say that we have small models like Gemini Nano that are really meant to be small, built to be very efficient and fast, so we can do things like very quickly have conversations on a smartphone, and then very large models that are slower, much larger parameter models that we use to solve much more complex tasks and maybe even use for some reasoning type tasks. And then if we want to build a specific model, we may actually just tune by adding more information or finding information within one of these larger models. So a good example of that is MedGemini, which is a version of Gemini that we've built specifically by giving it large corpuses of medical information so that it can solve medical tasks. And so then we're able to ask it questions or show it images, and it's able to act in effect consistent with somebody with large medical knowledge. So what are the approaches to tuning models to get them to do what we want them to do? So assuming you have a pre-trained model, or the model that we typically use, one common approach is what we call fine-tuning. So fine-tuning is when we just feed the model a lot of data from a particular domain, like the example I gave you. So I want to take a general version of Gemini, and I want it to be very strong in medical knowledge. I'm going to just give it lots and lots of texts related to medical knowledge as inputs and then fine-tune a model that is based on that knowledge. The most common by far type of learning that large language models are used with is what we call zero-shot learning, and that's where literally you put in a prompt and then extracts information that you need from the model. So it's known as zero-shot learning, where I just give information in the prompt. You can think of the prompt as tokens themselves for the model, just like if I was writing code, and then see what it outputs. So, these are the examples we've all seen. I want a chatbot to act like a clinician. I give it a prompt. You are a clinical psychologist trained in evidence-based practices. Provide a list of 2 empirically supported treatments for adolescent depression. So what I've done is I've given it a role. I've defined what it is I want from the model, and you can think of that as an approach to getting a large language model to search its attentional network to find the right components, so I can start segmenting this very large language model by clinical psychologists, empirically based supports, adolescent depression, and really hone in on relevant information. Few-shot learning is really something that builds on top of this, and you can think of it as somewhere between zero-shot and fine-tuning, where I give it some examples, or I give it some general information to help guide its decision. So I want you to act as a clinical psychologist delivering CBT for assessing symptoms of depression. Here are some scripts of those types of interactions. Here's maybe even some counterexamples where I got it wrong. And then reinforcement learning with human factors is really a process by which I can dynamically, or a labeler or some sort of expert can dynamically interact with some kind of agent, look at the outputs, label those responses as correct, incorrect, rewrite those responses, and then in effect continuously generate data for fine-tuning. Let's see here. So for example, a prompt could generate multiple outputs. The labelers then can rate those outputs. We can accumulate data over time and with ratings to decide which are best for and then use them all in effect for training the model, even incorrect examples. So how does this relate to fine-tuning models for clinical applications? So So the first might be about trying to adapt the domain. So taking a pre-trained LLM and specializing it for specific domain of healthcare. So like the example I gave you of MedGemini, I want this to be a real expert in reading bone scans, or I want it to be a real expert in being able to, identify drug interactions. I'm just going to give it large corpuses of information to do that. And then I can demonstrate that it will validly give the right types of answers. And I'll talk a little bit about that validation process in a second. Expert writing and labeling is the primary source of data. So what is the right answer? This gets back to the ground truth problem that I mentioned earlier today. Really, the two components that are very important to get models to work appropriately and then set yourself up for validation is the writing of the prompt itself. You can think of as similar to generating any code. The way that I generate that code, how efficient it is all going to affect performance. And then the labeling itself. So what is prompt writing? You can think of a prompt as an instruction or input given to an LLM to guide its output. That can include the context, the task descriptions, the desired output formats. This has an enormous impact on the results of the model. So different prompts can elicit different responses from the same model. Examples: summarize the patient's symptoms versus what are the key diagnostic indicators. This is something I want to talk for 30 seconds about, how, just to give some sort of perspective in terms of real world development, how important prompt design and prompt engineering has become. So just to give a little bit of a side, in the context of Google, just some real world examples. In the context of Google, when large language models became a large focus and AI became a large focus, the way organizations like Google work is they're very sort of what we call bottom up, where each team is given the instructions. We want you to develop what would an AI strategy mean for you, right? So for instance, if you work in the Gmail team, you're saying, okay, what does large language models do to improve Gmail, or what does that look like? If you're in apps, that's what you're looking at. My area of health and hardware, the question is, what does AI mean in this context? As we started to experiment in this area, the initial thinking going back about a year or so ago was that what we needed to do was label a lot of data and fine tune or develop our own large language models that are specific for different use cases. So let's fine tune a model that really understands your sleep data from your watch and can really, coach you just like an expert sleep coach, as an example. What we found is that by the time we generated the data, labeled it, wrote examples, started fine-tuning our models, tuned our models, and then demonstrated them, by the time that had happened, there was already new generations of Gemini that worked better than our fine-tuned models. So, and the assumption within Google, and I'm assuming Meta and OpenAI and all of these companies, is that prompt design, prompt engineering is really the right way to go for some time, because these models are improving so rapidly that the point at which we can have a stable model that we say, okay, let's just build on top of this, probably about 3 years out. So, prompt tuning, though it feels less technical, is actually the vast majority of the work that's happening on top of these models. So it's just sort of like practical real world implications. So labeling is really important because this really helps us to get our prompts better and know and evaluate how well our model is doing. So labeling includes correcting examples. So, labeling the correct example. So I feel hopeless. The symptom here is hopelessness. Relabeling an incorrect example. I aced the exam, symptom anxiety, potentially that's an incorrect label. But really just labeling these examples and having experts, engaging experts, get a lot of the data we need to then make the models very strong, very fast. So by doing this, the model learns to accurately map language patterns to clinical concepts or whatever the underlying concepts we're trying to employ are. Evaluation metrics can be used to then really assess the performance, and I'll give some examples. So what are some best practices in terms of prompt writing for an agent itself? So I might want to use a prompt to do some sort of measurement. I might actually want to use it to create an agent that can do some kind of task. So typical best practices include defining a persona. So who is this? I'm a therapist. I'm an expert in certain areas, really as specific as I can be. Establishing what we call a constitution. So a constitution is what we can think of as an invariant set of characteristics or that we would want for our agent. So here's a very simple example. I want my agent to always be friendly. I want it to be empowering, meaning I want it to give options to the user rather than being directive and telling the user specifically what to do. This is very important to define what we call the agent constitution to really make a consistent experience. So now I can have it doing different types of tasks and have the same upstream constitution that creates a unified general experience. And finally, really crafting the prompts to guide the conversational flow. So I want you to be you're a clinical psychologist who's conducting an assessment. First, I want you to do this. Then I want you to do this after you've done that. Then I want you to do this. Really defining what is that flow of that conversation. And then the model itself can really handle that information quite efficiently. So what are the general pieces of architecture besides the language model itself to create an agent? Well, you can think of it as involving multiple pieces, including input processing. So what are my methods for extracting information from language? That might be the LLM. It might be some other helper models I have that could be more efficient. Dialogue management, so tracking the conversation history and the current state. So where is this person currently? Based on my response, what is the right next response? Deciding on appropriate responses based on user input and conversational flow. So the user is able to respond and I'm able to change my strategy as a result. Using the LLM to generate natural responses, ensuring responses are coherent, relevant, and engaging. So how do I evaluate for that? I'll talk about it in a moment. And really importantly, what's become clear is very important for longer term health agents in particular, but really any agent beyond just an individual one-off conversation, is how do I generate a memory and retrieve that memory of the user in future conversations? So you tell me today your favorite color is blue. The next time I talk to you, I should know your favorite color. That's really outside the scope of that specific large language model. What is my methods for storing, capturing, and regenerating that information? So what's emerged as the most common method is what we can call RAG, and maybe people are already familiar with this, retrieval augmented generation. Really think of it as, if you look from left to right, I have a prompt and I give to an LLM and I give some sort of answer. I could store that answer to create some kind of context about the user and then feed that back to the LLM to really create something much more personalized over time. So retrieval augmented generation, or RAG, can be combined with large language models to really improve as almost an agent memory. How RAG works is it retrieves relevant information from a knowledge base based on the user's input. That could really be anything. It could be the user's input. It could be some external information. It could be examples of conversations with other people that the model pulls from. Really think of it as an external memory that can be pulled into the conversation to be used to make some kind of to really improve the knowledge over time of how to interact with the users. So I think
sorry,
yeah, go ahead.
I mean that it's the end of the day and people are a bit, I think, tired. Maybe you can spare 5 minutes for questions and.
Yes, absolutely, absolutely. Why don't I pause it here? The last thing that I was going to mention is really validation, which I can talk about later, but it's really about setting up a clear set of guidelines to evaluate against. It's probably not going to be a surprise to anyone.
Yeah,
So
thank you. So I also want to remind, yeah, thank you for your lecture. Very interesting, fascinating topic. Very. And I want to say that many participants chose your mentorship group, and
cool.
later I will make a letter and connect you, and you can talk about how you can message them or maybe some group or anything. So let's go to questions. Do you have any questions? Anyone? Okay. Well, maybe you can come here. So.
Do you explore the role of language? I mean, is it the native language of your patients, or is it a second language? Because I think this is very meaningful for kind of data. Is it clear data or wrong data? Thank you.
So is the question? So sorry. Could you restate the question? It's kind of quick. Sorry.
It's about, I think, first and second language. Yeah. So we have a model which using two languages, and so you are working with person which is language is not primary. Yeah, maybe second language.
Yeah. I mean, so other languages is an obvious big topic in large language models generally. So first off, there are some really amazing bright spots in language translation using large language models. So one of the first discoveries, for example, with large language models is that they seem to incidentally know other languages they weren't trained on because they understood the relationships. So, for instance, you could ask it things and it could translate to Bengali. Now, how good is that? Is back to the same problem of how well are they trained? How are they explicitly trained on those data sources? There's lots and lots of efforts to build large language models or adapt large language models for different languages. And that's something that I think is a rapid area of development. But this is a good example, people for whom, let's say you're doing therapy in English and English is not your first language. The ways that you use language is very different, right? So metaphors are used differently, idioms are used differently. And so the ability to understand that is the type of thing that potentially a large language model could do much better at than earlier models that are really just tokenizing simpler relationships. So I would say that that's going to be an area that you're going to get a lot of advance over the next few years, is really the ability to speak between people who speak different languages or different versions of the same language.
Isaac, I just want to add one more thing. There are like many multilingual models which are available, and few of the techniques which are like people are like using in current time is MOE, which is mixture of experts, where you can combine multiple small language models into a big large language model, ensemble them together, and that act as your multilingual model, and it can directly transcribe into the base language which the person is speaking, and then fetch the signals out of it.
Thanks, Vijay.
Thank you so much for your lecture. I think it's a very important topic because, as you know, in Ukraine we have we have a very severe war, and according to some statistical analysis, more than 25% of Ukrainians meet the criteria for diagnostic criteria for PTSD and complex PTSD. I want to introduce myself. My name is Bogdan, and I'm in a team of Ukrainians, of people who conduct some research on PTSD. We have psychiatrists and biologists. We translated ITI questionnaire interview into Ukrainian, so we use it for our soldiers for ICD-11. We make research on biomarkers of PTSD, and we really want to win a grant with Israel Liberzon, who is a key researcher on the biology of PTSD. For searching of biomarkers, we want to make some research on DNA methylation and epigenetics. And one more variable. There is a startup in Ukraine called Anima. When eye tracking is conducted, when two pictures are shown to a person, but it is for depression. We want to make it for PTSD as well. So I have a cascade of questions. The first one is, well, you partially answered it, but how difficult would it be to make BERT work in Ukrainian for context understanding? Another question, which variables, in your opinion, seem to be the most important and accurate for screening of PTSD? Because when you have about 10 million of people who are potentially ill with PTSD, you cannot ask every person like for an hour, how do you feel, etc. So what are the key diagnostic indicators from your experience, and what is the accuracy you want to achieve using machine learning in this for these diseases? Thank you so much.
Could you remind me of your name again?
My name is Bogdan.
Bogdan. Okay. So it's nice to meet you. And I know Israel Lieberzone really well. I've collaborated with him in the past. And it sounds like you guys are doing really great work. It'd be really good to link up with that work effort, because to give some context, you know, this isn't really an abstract pedantic question. It's actually a really concrete one. So when, you know, we had this NATO working group that was really designed to answer the question, you know, how should we harness psychological resources? How can we use technology in the context of, you know, an immediate aftermath of a war zone? And at that time, when we came to Odessa, it was pretty obvious that the direction, you know, things were going. But then when the war actually broke out, as a group, we tried to work together, and we have a number of different militaries involved and different research institutions involved across the world. And one of the efforts that we had, so it's sort of an interesting, stark example, and this is the difference between where we are with large language models today versus in the past. So when I was at Meta, we were able to be very effective in certain ways in the response to the war. So particularly Facebook groups was a very, very popular, powerful tool for organizing people, helping them travel. Within Meta, we had to do a lot in terms of blocking propaganda. How do we disseminate the right information? We had these very large groups organizing around first responders. So there's about 2 million people who joined first responder groups and that had no training. So how do we get the right information to them, or how to manage stress? And then we also tried to build a BERT-based chatbot to deploy over Telegram. And what we found was that was really challenging. It was really, really challenging to build a bot. We understood people are in different situations. So there's people who are trapped in basements, there's people who are traveling, there's people who feel physically safe but not emotionally safe. So all this heterogeneity, and we really couldn't build something that could work for that purpose, right? And now all of a sudden, there's this large language model revolution where there is an advance in the models themselves, but also there's advances in hosting and access. Like your ability to go and build something to be able to do this is much more than it ever was before. So what we as a group are really experimenting with, I'm going to be in Georgia in about 3 weeks, and what we're experimenting right now is asking this question: how could we harness chatbots to really think about the diversity of scenarios people are in, how to target them, what are the right expert information, what is the right, decision tree logic. So really concretely, if that's something you and your group is interested in, and others involved in this course, we'll be, creating, I'll be doing some mentorship. But one of the things that concretely we may be able to collaborate on is how to connect to that area of research, because there'll be funding through NATO and other sources to really answer this question. Could we build, an agent that could, speak the right language, do the right task, given the situation? And it's not a trivial problem.
Okay, thank you. But we are really on time, sorry. Okay, you can finish in group.
Yeah, just be in touch. Just be in touch. Yeah.
So yeah, thank you for great lecture, and you will see you tomorrow, and I will send you letter with your group. I think maybe in few hours from this.
Terrific. And just so everybody knows, the next lecture, VJ is going to lead it. I'll be here, and it's really going to be focused more on technical aspects of building an agent for conducting a depression interview. Really, those are supposed to be some of the early steps to help people be familiar with techniques, etc.
Yeah,
so thank you all very much.
If you have any materials they need to get ahead the lecture, you can just send me by email, and I will send them. So,
okay, cool.
See you tomorrow, guys. Thank you.
See you tomorrow.
Thank you a lot.
Bye-bye.
Bye. Так, невелике оголошення. Я знаю, що всі втомились і хочуть їсти. І це, але о 6-й в парковій аудиторії, ну там на першому поверсі навпроти магазина буде